And as the country moves to the next phase of getting people vaccinated, many are still discussing the CDC's sudden shift on wearing masks. The guidance left some people with more questions than answers. So who still needs to wear a mask and why? Dr. Frank McGeorge is here to help us understand it. Hi, Doc.
Hey, Kim. Yeah, so first, I need to stress the CDC guidelines are for those people who are fully vaccinated. But practically speaking, we know that there are many people who are going to stop wearing masks even if they aren't vaccinated. And that is part of the equation for who still needs to mask up. Masks are still needed indoors for those who are not fully vaccinated, simply because they are at higher risk and pose a higher risk for others.
The science is also very clear about unvaccinated people. You remain at risk of mild or severe illness, of death, or of spreading the disease to others.
But even some who are fully vaccinated should still strongly consider wearing a mask, especially indoors or in crowds.
If you are immune compromised, you will most definitely want to talk to your doctor before giving up your mask.
That includes transplant recipients, cancer patients, those on dialysis, and on medications that suppress the immune system. There is concern that the vaccines may not be as effective in people with weakened immune systems, meaning they may not be as protected as others. They may also be at higher risk for complications if they do become infected. It's also essential for children under 12 to keep wearing masks as well.
When the children go out into the community, either in indoor or in certain outdoor settings, they should wear a mask if they're unvaccinated. When they ultimately get vaccinated, it will be the same as the adults.
Cases of COVID have been climbing in kids, and while they are less likely to suffer serious complications, in Michigan, there have been 138,000 cases and 12 deaths in children. Now, this means many parents may want to continue wearing masks as well when they're out with their children, particularly to model that behavior to them. A vaccine is not expected for children under 12 until the start of 2022.
So, Doc, I'm sure you're fully vaccinated, but when do you still plan to wear a mask?
Well, definitely in the hospital. In fact, based on how well masking and other measures actually just crushed this year's flu season, I'm probably going to always wear them in the hospital now. Indoors, it'll depend on the local requirements and how crowded a place is for me. And outdoors, I actually generally do not wear a mask anymore.
Yeah, well, thank you for sorting it all out for us, Dr. McGeorge. We appreciate it.